I didn't want to give a presentation on just any subject. I wanted to find something that I personally related to, something that I cared about and that I wanted to learn more of. 2 months ago, when I just started reading the book, I found exactly what I was looking for. The issue I wanted to discuss is PTSD, post-traumatic stress disorder. I specifically chose this topic because I was in the military for 5 years, and I have served alongside more than a few men and women who have taken their own lives because of this disease. What is PTSD? Post-traumatic stress disorder is a psychiatric disorder that occurs in people who have experienced a traumatic event that has a lingering impact on them. What are symptoms of PTSD? While the symptoms of PTSD vary greatly from person to person, there are a few common ones which can be expected to be seen. These include excessive fear and worry, trouble sleeping, flashbacks, hypervigilance, general changes in behavior, and depression and apathy. These are only a few of the signs of PTSD. Who is affected by PTSD? While PTSD can affect any person, it has been shown that it is nearly twice as common among U.S. veterans. As the graph shows, there is a 12.9% incidence rate of PTSD among veterans. Other data may show that it goes upwards of 20 to 30%. Over 500,000 veterans who have served in Iraq and Afghanistan have been diagnosed with PTSD. How does PTSD affect the brain? When experiencing a traumatic event, the amygdala reacts with fear and by emitting neurotransmitters which combine to make up the fight or flight response. People with PTSD tend to have an overreactive response. Something as simple as a firework may trigger a response that would normally be given to a gunshot. How do we treat veterans with PTSD? The most common form of treatment for PTSD is cognitive behavioral therapy, CBT. CBT is a counseling approach-based method where veterans are encouraged to change their distorted view of reality by improving coping methods and their emotional regulation. While there are other methods, this is the most common.